According to the National Eye Institute, cataracts, glaucoma, and age-related macular degeneration are the most common eye diseases that affect Americans over the age of 40. It's Cataract Awareness Month, so our friend Dr. Brent Wallis from People's Health, joins us to explain the disease and how you can optimize your vision. How you doing, Dr. B?
Hey, Tommy, I'm doing great. How about you?
I'm okay. You staying hydrated?
Yeah, I'm trying. It's difficult out there.
It is. I've had both eyes done, cataract surgery, didn't miss a day of work after either procedure, but, you know, Doc, that's the way I am. Let's start by talking about what is a cataract and what causes it.
Sure. So a lot of people do know about cataracts, but really what they are is they're a clouding of the lens that is in your eye. And when that lens gets cloudy, what happens is it causes blurry vision, or sometimes people describe it as fuzzy vision. And you can get cataracts in just one eye, or you can actually get them in both. But what happens is they usually start real small, and then they tend to grow over time to a point where they then start affecting your vision. And, you know, the most common reason we see cataracts is aging. You know, they become much more common as you get older. But we also see them for a couple of other reasons. You know, eye injuries, any sort of traumatic injury to the eye can result in a cataract. Here in Louisiana, sun exposure is a really big problem. The UV rays from the sun can actually cause clouding of the lens. And then in particular, things like smoking and alcohol use can actually have some effects on your eyes. You know, medications are important too. People that have to take steroids for certain medical conditions can have accelerated development of cataracts. And then really in particular diabetes. You know, diabetics actually have a lot of different types of eye disease, but their cataracts actually tend to progress faster than people without diabetes.
You know, you cleared that up for me because I'm not that old, but I did play God knows how many hours of golf and rounds in the sun with no eye protection, no hat, no nothing. And I did used to drink it up back in the day, so I guess that explains it. What are some of the, for me at least, what are some of the symptoms of cataracts, Doc?
Yeah, there's a lot of things that people experience. You know, definitely poor vision. You know, as the lens clouds, it makes it difficult to see through that lens. And typically people will have problems more commonly at night. You may see it while you're driving, you know, little halos around people's headlights and stuff. They get a cloudy or kind of a blurred vision, and then some people will develop a sensitivity to light. So when a light shines in your eyes, it kind of hurts a little or gives you a headache. Some people will actually develop a loss in color vision, so they really don't see colors as crisply as they used to. And when they get more severe, you can even get some double vision or multiple vision in one eye. One of the first things we see, though, is people that wear glasses may find themselves having to go back to their eye doctor and get their prescription changed multiple times, and that's because the cataract is really advancing. You know, and if it is a complication of diabetes, people with diabetes who develop cataracts usually have that blurred vision and actually a lot of trouble with glare as well.
Let's talk about treatment options. And I remember back in the day, at least when I was a kid, you know, relatives having cataract surgery, and that was seemingly a big deal. But now we've come a long way, have we not, with treatment options?
Yeah, definitely. It's pretty easy. The surgery definitely is one option, but there's a few things you can do as the cataract is progressing. You know, sometimes you'll get an exam. The doctor will see a little cataract. They'll tell you about it. A lot of times they'll tell you a percent cataract that you have, and you watch it for a little while and see how it develops. What a lot of people will do, you see this a lot in restaurants. They'll use a magnifying glass, or they'll turn the light on their phone to read the menu. Sometimes that increased light can actually help you see a little bit better through the cataract. But as the lens clouds more, it really does start to reduce your vision. And so ultimately what usually happens is you have to have a surgically implanted lens. And like you mentioned, the surgery is very easy. It's a day procedure. There's really no downtime. Doesn't take longer than an hour. And they basically remove the cloudy lens, insert a new one, and then usually people have crystal clear vision. You usually do have to wear glasses after you have the surgery, though.
Thanks for making me feel like not a hero, Doc. Just kidding. We're going to take a break. We come back, we'll talk about the preventability of cataracts. And Also about diabetes as it relates to that. We're talking to Dr. B. It is Cataract Awareness Month. And we'll be back with Dr. B from People's Health in a second. 8:20, time for traffic, WWL. Tucker, WWL, quickly back to Dr. B. Dr. Brent Wallis, our friend from People's Health. It's Cataract Awareness Month. Doc, are they preventable?
Yeah, unfortunately, there's no way you can completely prevent cataracts. But, there are some things you can do, probably primarily see your eye doctor. A lot of people don't realize anyone who's 60 or older should get a complete eye exam every 2 years. And that includes a dilated eye exam so they can really look in there and see what's going on. There are some lifestyle changes you can make that can help to prevent or slow the progression of cataracts, though. Diet plays a really big role. Antioxidants are very helpful, and that's any vegetables that are kind of dark greens, things like collards and certain types of lettuce and kale. Those are very helpful to your vision in general. And then, like we were talking about before, when you're out in the sun, wear sunglasses, something with UV protection, and probably a hat as well, because you want to prevent that direct sunlight from getting into your eyes. Certainly don't use tanning boots or sun lamps, because that will accelerate things as well. I mentioned steroid medications. If you can avoid them, do, because that's going to accelerate cataracts. And then really the most important is for any diabetics that are listening, keep your diabetes under control. Cataracts can be a real serious complication of uncontrolled diabetes.
Yeah, talk about that a little bit more, if you will. Talk about the correlation between diabetes and eye disease.
Yeah, diabetes can cause all sorts of eye disease. And, in particular, cataracts develop about 60% more commonly in diabetics. Glaucoma is about 40% more common. You really have a lot of risk of retinal disease and macular degeneration, which can all be really high risk for vision loss. That's why we talk about diabetics losing their vision so frequently. And the problem is the longer you have diabetes, the more your chances of developing an eye disease increase. So if you can keep your diabetes well controlled, you're going to have a much lower risk in the long run.
Some final advice for people who want to optimize their vision, protect it?
Yeah, I think like I said, the most important thing is prevention. Really going to see your eye doctor regularly. Like I mentioned, over 60, you need to see an eye doctor every 2 years. Diabetics should probably see their eye doctor annually, especially if they have early eye disease, just to make sure things aren't progressing. And keep in mind, if you have regular Medicare, vision coverage is not included, so you have to pay out of pocket for that. If you do have a Medicare Advantage plan like People's Health, the routine eye exams are going to be covered, and quite often you can also get free eyeglasses or contact lenses. And the other thing to keep in mind is eye disease runs in the family. And so if you've got a family history of someone with cataracts or retinal disease or glaucoma, you want to make sure you let your doctor know about it, because that's going to mean you have an increased risk as well. A couple of other kind of closing thoughts, though. Exercise is always important. That increases the blood flow, keeps your eyes healthy, just like it keeps your body healthy. And, maintaining a healthy weight is very important. That'll help control your diabetes as well, because you've absolutely got to keep your sugars down and keep your blood pressure under control. And then I say it too often, but if you smoke, you got to quit.
I don't think you can say it too often.
Yeah, smoking is definitely related to eye disease as well as everything with our health in general.
And people, I think, have a false equation of smoking. Well, something's got to kill you, and they think it's going to be a quick heart attack that's going to do you in, and that is not the way it works. So, again, Doc, I don't think you can say it often enough. If you smoke, quit. If you don't start, right?
Yeah, definitely. There's a lot worse things that can happen than a heart attack. That would be probably one of the more fortunate things that could happen.
That's a good way to look at it. How can people find out more about People's Health, Doc, the 5-star People's Health program?
Yeah, they can always go to our website at peopleshealth.com. This and a lot of really great health information is available on there. They can also come visit us at our Medicare Center, which is on Veterans Boulevard right next to Party City. You can make an appointment, or you can walk in, talk to us about this, or really anything Medicare-related or health-related.
You can call 1-800-978-9765. You can follow People's Health on Facebook, Twitter, and Instagram. Doc, a lot of people play golf. I do, and I mentioned that maybe that had something to do with the early cataract surgery because I played a lot of golf with no hat, no nothing. Should you wear sunglasses when you play golf?
Yeah, you definitely, and make sure your sunglasses have UV protection. Some of the less expensive ones may not have it. And then wear a hat with a brim, so a baseball cap or one of those floppy hats will help protect your eyes for sure.
And keep your left arm straight. Thank you, Doc.
Thanks, Tommy. Have a great weekend.
You too. Dr. Brent Wallis with People's Health. 8:30, we'll talk to Mark Rosa about the action of the Fed yesterday when we return. Right now, it's time for WWL First News. For that, we go to Dave Cohen.